Hello viewers, good morning Nigeria. You're welcome on yet another promising edition of My Health and I. Today would be a very special edition, being that our motherland has added another year to its chronology, and today we would be discussing the National Health Act and the state of healthcare in Nigeria. With me today in the studio, I'll be your host today. If you've been following the show, the regular host is unavoidably absent because he's busy today. And today with me, I would be your host, and I am Dr. Nyango Philip. With me in the studio are very notable healthcare professionals, and we're privileged today to have a university done. Today we have a medical elder with us who would be shedding light, bearing his experience on the status of the National Health Act as it bears on the state of healthcare in Nigeria. And there would be three guests. One of our guests is on his way, but I would be moving straight ahead to introduce our guest, and I'll be starting with our father, our medical elder, Dr. Musa Dankel. He is also a professor. I would allow him to take some time to tell us who he is, what he does, and to give us a brief. And after that, Dr. David Berlin, who is a regular on this show, would also greet us and felicitate with us on the addition of another year to the Nigerian age.
Good morning and happy Independence Day to all Nigerians. My name is Musa Dankel, as he said. I'm a family physician, a family doctor. I practice as a consultant family physician at Bingham University Teaching Hospital. I'm also a professor of family medicine at the College of Medicine and Allied Health Sciences of Bingham University, where I also serve as deputy provost. So it's a pleasure to be here this morning and talk about health in Nigeria and the state of health. Very big topic for us as Nigerians and at Independence.
We're glad to have you here, Prof. Dr. David Berlin.
Good morning, viewers. Happy 61st anniversary.
Well, viewers, you clearly have heard, and today with us is a professor of family medicine and a resident in training of community medicine, and I am here also an academic, an anatomist, and a medical doctor by practice also. With us shortly would be Dr. Dogara Jwat. He's on his way, he's not yet here. But Prof, I would like to start with you. The National Health Act also would be celebrating some sort of a birthday this month, because the National Health Act was signed in October 2004, rather 2014, and we know that the National Health Act went through a decade of debates and proposals before it got to be passed. The National Health Act, as we know, is the pinnacle document that gives direction to the country as to the do's and don'ts within the healthcare space. We would like to know, how has the National Healthcare Act fared in terms of piloting and giving direction to the national healthcare space, in terms of leadership, in terms of clear direction of simmering down policy for giving national reason and achievement, bearing in mind that we're celebrating independence, Prof?
Well, thank you. The National Health Act, yes, it's a document, but a very vital document. Prior to the National Health Bill, which then became the Act, as you said, was debated for quite some time. Health in the Nigerian Constitution was one of the fundamental directives of state, but was not justiciable. There was no clear statement on how exactly it's organized. And one of the key things the National Health Act did was to define the national health system and to say this is our national health system. It means those who are at levels of policy, ministries, ward committees, local government health committees, etc. Those who are providers from public to private, alternative medical practitioners, all of those were brought in and defined as a system. Now, the consequence of such a systems approach was that it enabled us to, at one glance, look at the real factors that now lead to production of health. Beyond that, it also helped to look at the flow of authority, as well as enabled us to then begin to cost what it would take to run such a system. So it's a fundamental document that we didn't have before, and by implication, it's coming into life. Therefore helped us to begin to see some things in a systems approach. Beyond that, it has also helped us to then, like I mentioned, the costing. One of the things with health is that if you don't cost it properly, you are not able to therefore guarantee that it will do what it's supposed to do. So it's helped us to see what's going to cost. National health accounts were started because of that. And then beyond that, we've seen that without pushing for universal health coverage through insurance, it will be impossible to deliver on the gains of it. And then here and there are other elements. Since we say in the Act that we need to provide emergency care as a right to Nigerians, it has forced us to then say, okay, how do we make that work? It's one thing to say anyone who is a victim of a road accident, for example, must be treated in a health facility. But how do you make that work? How do you provide the resources to take care of that person and take care of the next person so that it's sustainable?
Well, Prof, with clear recommendation and clear applause giving our nation as we celebrate independence today, some accolade for making sure that we have the right policy, the right legal direction in leading our healthcare space. What would be your take with regards to, one, the flow of leadership, the experience of Nigeria at 61, and as a university don, as a trainer of healthcare professionals, where and how would you score our adherence to the National Healthcare Act?
Well, that in itself, one of the most fundamental issues for Nigeria to look at as we clock 61 is the issue of leadership. This falls into all the spaces we can talk of: political space, education, and so on, as well as in health. One crying issue that comes up when we hear people complain that this isn't happening, that isn't happening, or it's not happening well, really it's a cry for leadership. And the health space is not it's not missing in this. Now, like I said, leadership and governance in the health system is so fundamental to directing the use of all the other resources so that you deliver health service. Without leadership and governance, you really can't make the finance, the human resource, the equipment and medical consumables work together to give people good quality health service. So leadership and governance is critical to it, and in my view, the most fundamental thing that has made us not achieve all that the Act is supposed to achieve is deficits in this aspect of leadership and governance, and this cuts across from the highest levels down to the ward level, which is provided for in the national health system.
Thank you very much, Prof, for that. Dr. David Berlin, with regards to your training as a community physician and where the National Health Act places health systems, the whole leadership chain, and most importantly, the pandemic, what would be your thinking as to how the National Health Act has helped in helping Nigeria mitigate the outcomes of the pandemic vis-a-vis the design of the health system? What would be your thoughts on this?
Well, thank you.
Yeah.
My thoughts on this is simple. Like Prof rightly said when he started, you see, the way the health system is being structured In the part of Nigeria, we've done very well in that. We have a good structure for the health system. We have the health system being structured at the federal level, at the state level, and then at the ward levels. And talking about how we see it in public health, it's quite simple. At the local government level, due to one of the changes for health under one roof in achieving universal health coverage, we sought how the health department at the local government level will be moved to be a separate entity on its own, or rather to be under the state primary health care board instead of being under the local government. So yes, they could operate at the local government, but they are actually under the primary health care state board. And then at the state level again, we have the epidemiological centers that do operate on their own. They are responsible for all emergency operation centers that will be open in case of emergencies. Give an example with this pandemic now that occurred. Before the pandemic, actually, we've had a bit of epidemics here and there. We had Lassa fever. I remember I grew up in John Kwanu. We call it John Kwanu, that's Bingham Evangel Teaching Hospital. So then they could show us an old movie of a woman, a white missionary lady working at Lassa in Borno State, and how she was brought to this same hospital, and the roof was red, it was rusty, so that's why they call it John Kwanu. Unfortunately, Lassa fever is one of the viral hemorrhagic fevers that we still have today, still ravaging, popping up here and there, having a bit of epidemics. So the emergency operation centers and domicile in the epidemiological unit in the state have been key in that. So it's easy for us to now start transmitting results and centralizing operations around that center when it comes to any epidemic, especially also with the COVID pandemic. And then at the state level, national level again, that's why we have the Nigeria Centers for Disease Control, which is almost known globally now. It's quite famous because of the work we've done. So the way the system has been structured has actually helped us. And again, the rider to our process, the National Health Act was actually a good document that came into being to help the national health policies we already had on ground, and also to fortify the national health system we had.
Wow, great feedback. This means that our country is on course to achieve greatness, and we're capable of achieving whatever we dream of. And it's not all dark as naysayers would want to paint it, but we may really consider what the drawbacks have been shortly. Listeners, please, thank you for being with us. Please stay tuned. We'll continue with this discussion shortly. Yes, viewers, we're back on the show, and we have the fourth discussant on today's show present with us now. Dr. Joga Jwat, you're welcome to this show.
Thank you.
Would give you some time to tell us who you are and what you do, and greet Nigerians at 61.
Good morning, Nigerians. Happy Independence Day to all of us. God has been faithful, seeing us to this age and time and in one piece. I'm Dr. Jwat Dogara Emmanuel, a senior registrar in the Department of Family Medicine in Youth, and also a businessman. So I'm happy to be here this morning.
Well, surprisingly, some doctors are in business. I hope the National Health Act clearly allows for doctors to participate in business. Well, having said that, clearly the National Health Act has provisions for the use of body parts, I mean tissues, in all scapes and climes for various uses. The National Health Act clearly gives the legal frame as to the do's and don'ts with regards to human tissues being used for healthcare. Dr. Jwat, what would be your thoughts as to how we have clearly managed healthcare in terms of blood donation, the availability of this demand with regards to the wide-scale prevalence of trauma around orchestrated by violence and the demands known to healthcare? What would be your thoughts? How have we fared as a country at 61? What are the recommendations going forward?
The use of blood parts in medical care is one of the great and giant strides of medical care, especially use of blood and blood products. In this age of lots of trauma from road traffic accidents, communal crises, terrorist attacks, and this has been one major giant stride in the act. The National Blood Bank has been very helpful. If you've been able to have a stroll to the National Blood Bank, you see the traffic, and that's tell you how helpful it has been. But it's lots of challenges in terms of getting donors, in terms of finances, to be able to make the process more smooth and have all the reagents and things to screen the blood. And I want to use this opportunity to sincerely thank all free will donors to the National Blood Bank, and to encourage those who haven't started to do it as a living sacrifice, as donating part of yourself to help save the life of someone who is in their need. Hopefully we'll eventually get to a stage where donors for other body parts will start having the technical know-how and the resources and the equipment to be able to do the transplants of liver, heart, and other things. But for now, one of the most effective parts of that act is the blood donorship, and I think we've done so well in that it has been helpful, especially in just when we have crises, attacks here and there. I think it is one part of the act that has been helpful, but there's lots of room for improvement. There's room for government to continue to support financially, and also needs to have more people in that specialty, train more people in the laboratory aspect of medicine and other medical assistants in the laboratory to help, and also also one of the ways is to improve the awareness amongst the people in the rural communities and other, even in the urban society, on the need to donate blood in order to save people who may be in their need of
well,
blood
thank
transfusion.
you, Dr. Jwat. Sincerely insightful, and we clearly can see a synergy that it's not been all bleak, it's not been all hopeless. There's so much hope for our country, because we clearly can see that we're capable of achieving anything we set our hands to do. we have a National Blood Transfusion Agency, we have clearly designed systems that can service us. Prof, you earlier had given us insight as to how the National Healthcare Act has provided for universal coverage. How far has Nigeria gone with regards to health financing and with regards to being available for the myriads of demands? Dr. Jad just mentioned the need for training, staff training. Unfortunately, there are myriads of industrial disputes now. How do we juxtapose health financing with regards to universal health coverage and the need for personnel training? What would be your thoughts as a manager in this space?
Thank you. Like I mentioned before, all the components you need to deliver health, they are framed by two major principles, leadership and governance, and then financing. If you don't have those ones, you won't be able to make the human resource, the equipment, the other resources to work towards health service delivery. So financing is critical to making that work. The most sustainable form of financing that has been agreed to make this happen is through health insurance. People have tried all sorts of things. The community health physicians will tell you there are up to 13, 14, 15 different forms of health financing. But health insurance, it's probably the best way you can sustain all of that. And the problem with health insurance is until you have almost everybody covered, you will still be struggling. And that is the reality. We have this great plan to finance our healthcare through health financing, but very few people, a small proportion of the population are actually covered. By some estimates, we are still floating around 5% covered. So until you have hit probably around 80% coverage, you won't get as much gains as you should. And so that's one of the challenges for us. And one of the core issues at heart is many issues of insurance. If you make it voluntary and you don't make it mandatory, then it's going to be difficult. So in a country where you can't ride a motorcycle without at least third-party insurance because it's mandatory, I don't see why health insurance should not be mandatory. So until we get to that point, we won't be able to get many people covered. So disproportionately large numbers of people are still paying for health out of pocket. And out of pocket is fragmented. It's actually a very inefficient way of paying for health service, and majority of the people looking at the poverty level will be unable to pay out of pocket. So we will not achieve what the Health Act intends for us to achieve until we have universal health coverage, until almost everybody is covered by health insurance, either social health insurance for those who can't pay for it or some sort of insurance. So that is my take, that we have not achieved what we should, because an abysmal proportion of the population is covered by insurance.
Sincerely, thank you for these thoughts, Prof. And it obviously is an indication that at 61, our country has to do so much work in terms of driving the enrollment into the financing plan as enshrined and proposed in the National Health Act. And it's clear that this seems to have had an effect even on the pandemic. And this has an effect, a multiplier effect on the general variables of the outcomes of healthcare nationally. And this would take me to the essence of research on national health. Currently, there are industrial disputes. Largely, the resident doctors in the country are on an action. And Dr. David Berlin, with regards to the National Health Act, there is a provision for medical research. What are your thoughts as to how medical research locally has helped in mitigating the effects of the pandemic? And what would be your recommendations going forward for Nigeria at 61 as to how we can propel investment in medical research to forecast and really model how to prevent disease occurrences of all the epidemics we've had?
Well, It's right. There are provisions for research, but you see the problem we have. We start from the manpower. You don't even have enough manpower, and then even with the manpower you have, you try as much as you can to do a bit of a research and then to also do the work they're supposed to do. But you find out that when it comes to financing for research, is funding is a whole different matter entirely. Let me just take us back to the healthcare itself, how we definitely get our funding into. When you could see healthcare, the legal people will tell you healthcare is on the concurrent list also. The federal government finance majority of the healthcare services that we see all around. States do have some sort of financing, but we know how it is with some of the states. We've had news about the value-added tax, the tussle in the courts. That's to give you an indication that we still haven't yet achieved federal fiscal policy yet. Liberation rather. What I'm trying to say is we've not financed healthcare to the extent to provide good health services, and so research too has been thrown out of the way or pushed aside, even though people have tried as much as they can to do a research, because some of the statistics that we do have, that we also do publish in a demographic health survey annually, is usually from the research that we have, and those are the data that we actually make use of to know the state of healthcare in the country. With the pandemic, the Plateau State government formed a committee. There's some notable professors and tutors in the university, as well as in the area of healthcare services. We have pharmacists, laboratory technicians, scientists, doctors, and they were able to come up with some herbs. I think they call it a plaque of something or so. But you see, the limitation of the research cannot take whatever it is that they have brought to be known internationally. Whatever it is we have has a limit of where it could reach. I remember there's a snake vaccine that they brought about, derived from plants actually. The same thing, they couldn't get the funding to reach up to the clinical trial stage 2 or so. They were able to do for stage 1, and when I was talking to one of them, they were actually complaining of how much of their own personal funds they put into it. So there's still much to be done in the case of research funding.
Wow. At 61, it clearly is evolving that there is a great financial demand for servicing the provisions of the National Healthcare Act, and it's getting manifest that to move forward, to move to where Nigeria desires to be, there must be a deliberate effort to put in the right commitment to funding for medical research, pharmaceutical research, and all of the components that make up befitting healthcare services for Nigerians. We'll be going on a short break, and when we return, viewers at home would be able to call in and bear their mind on the National Health Act and the state of healthcare in Nigeria. When we're back, the phone lines will be open, and the phone number would be on the screen for you to see through and call in. You're welcome back, viewers. You're still on My Health and I. We're on a special Independence Day edition of My Health and I on Aircore Television Africa. We're discussing the National Health Act and the state of healthcare in Nigeria. And with me in the studio have been Professor Musa Dankel, Dr. David Berlin, and Dr. Jat Dogara. Funny enough, the family physicians have taken the show today. And it's because Nigeria is a family space, and we're grateful that we're making progress in Nigeria, as we have seen and as we've heard. The National Health Act has provided the clear governance frame for health services in Nigeria. You can call in and bear your mind on what you think about the National Health Act. The phone number to call is clearly on the screen, and you can call in, bear your mind, ask questions. With us today are competent hands to answer all of the questions you would have on what the National Health Act entails and whatever questions you have. The National Health Act clearly provides governance for tissue parts. There are evolving uses of tissues in healthcare. One of the most prevalent challenges for the family in Nigeria is infertility. There are evolving demands for donation of gametes. As we know, today in Nigeria, the costs of artificial reproductive technology is quite rooftop, probably because of the financing demands and the demands of in terms of drugs and the services, the laboratory demands for providing technology to mitigate infertility. Okay, we have a call. Hello? 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 Okay, so there are demands as to what gametes should be donated and what infertility is. Dr. Jat, what are your thoughts? And could you please educate our viewers today as to what assisted reproductive technology is, and just a brief about that? Okay, hello? Hello, we can hear you. Okay, Dr. Jat, please.
Okay. Things are really changing. The mindset of people, Nigerians and Africans at large, is gradually changing towards assisted reproductive technique. We are having, for various reasons, increasing number of infertile couples. And when we say infertility, it means that the inability of a couple.
Sorry, we have a call. We'll take this call briefly. Yeah. Hello? Please, can you turn down the volume of your TV set? Yes. Dr. Jat?
Yes. So it's the inability of a couple to be able to achieve pregnancy after 1 year of consistent regular sexual intercourse. And so we're having these issues coming up, and various reasons could be attributed, as in both partners could be the source. Could be the female factor, could be the male factor, could be both. And so assisted reproductive technique has come to help ease the stress, the psychological stress. You know, in Africa, once you give birth, you get married and there's no reproduction, it brings a lot of pressure, first on the woman and eventually on the whole family at large. And so assisted reproductive techniques have helped to ease that burden. And just as you've pointed out, is the cost, and depending on the factor, where the factor is. When you have the female factor, these days we encourage egg donation, also encourage sperm donation. In fact, coincidentally, just within this week, I saw a patient with the male factor. You know, we did a seminal fluid analysis and there was really no viable sperm. And so that means the option they will have is to have a sperm donation for the woman to be able to get pregnant. But now this, because of our culture, it's something that it's very difficult to accept, because start thinking about this child is not really yours, this and that. And so it's something that few people are beginning to accept. But it needs a lot of awareness that this is a donation that is legally yours. So once you have the child is legally yours, just as an adoption, which is still something we are still battling to have people accept as a form of getting a child legally. And so accepting gametes, either being the egg in case of woman having problem producing her eggs, or the man inability to make good sperms, is still a big challenge in terms of acceptance in this part of the world.
Well, thank you, Dr. Jot. It means that our country is quite civilized enough to make the right legal frames and prepare us for eventualities. And this is a call further to increase awareness in terms of right education for the public to know that just like blood is donated, gametes can also be donated, organs can also be donated, and these systems, the National Health Act clearly provides for these activities in healthcare. And it's good that the public understands, and the ultimate goal of the National Health Act is to provide clear legal protection for all of the services to ensure the quality of life is protected and health services go seamlessly. As it is, this has shown us that our country is work in progress. As we critique, yes, there are areas of there are areas of criticisms, but it's not been a bleak story for us, and this means that we can really get to the moon if we aspire to get to the moon, and it means that we can achieve whatever we set our hearts to achieve as a country. Sir, as a leader of an institution, the National Health Act is not entirely a doctor's health act. It is not, it is a health act. And as we know, the healthcare space is a multidisciplinary space. What are your thoughts as to the evolving relationship of healthcare professionals as enshrined in the Health Act and the reality we see in the health delivery space? What are your thoughts and recommendations?
Thank you. The Health Act tries to describe the ideal, and the ideal is that all of those who participate in providing health for Nigerians, whether they are health service providers or health management support staff, are all part of the same space, as you call it. And it assumes that they will work together. It's a fundamental assumption, each bringing in his part to make sure that what we have is service delivery. Now that's the ideal. In reality, what we've had is people breaking up into silos and wanting to do their own thing without working together as a community of workers to deliver health service. So obviously that's a big problem. We can't look at that without the overall political turmoil in the country and the economic challenges. Some of these things you are seeing are not directly a product of conflicts within the healthcare space, but the fact that people are struggling with economic stress.
Hello?
And so they want to get the best they can.
Sorry, Prof, we'll get back to you. Yeah. Hello.
Hello, good morning.
Yeah, good morning. Please, can you tell us?
So, I can see the program going on the television, and
yes.
I would like to, first of all, thank you, Peto, for your contribution to today, because it made me to be aware of so many things. And I would like to inquire how we can get across the numbers of national health insurance in
Okay, great question. Is that all?
Yes, it's all.
Sorry, please, can you tell us your name and where you're coming from?
My name is Mr. George Okena.
Okay. Okay, thank
Calling from Enugu.
Okay, thank you, Mr. George. Happy Independence at
Yes,
Enugu,
so
and we wish you
reason
safety
for
at
health insurance under
Enugu.
one
And
roof that we-
would make sure we search for that number, and I'm sure the management of ECWA TV has listened to that. But clearly, the website of the National Health Insurance Scheme is up. It can be Googled, and I'm sure there would be a contact for that. Prof. we'll
Yes,
cut
well,
to you on that.
actually, I was pointing to him because this is one of the reasons for the health insurance under one roof
Yeah.
concept,
Yeah.
to enable people to, at their local level,
Yeah.
to be able to enter into health
So-
insurance. Yes.
So sincerely, we've digested and discussed extensively what the National Health Act entails, and we clearly have seen. Yeah, we'll take this as the last call here. Hello, happy Independence. Yeah, good morning. Yes, can you please tell us your name and where you're calling from? Hello. Yes, go on. Yes, we can hear you.
Yeah. Okay, yeah. What I'm trying to do is one, due to bad government, limited dollars, some illness are not something family one less can do. The part of how government has been able to help companies. So let federal government make it what is it with people. Make this please, so people
Sorry, that wasn't so clear, but we clearly can hear some displeasure about the disease spread in the country, and this underscores the whole design of the National Health Act and typifies what the experience is with regards to healthcare in the country. We've had a very modest discussion, and with this we'll be drawing the curtains. But before we do that, some last thoughts as to what we think and recommendations as to government. Prof, please, 30 seconds.
Like I had mentioned before, while there are lots of issues, there's hope. And I think the path we need to take is universal health coverage. If Nigerians are insured, then you are talking about not just financing, but organizing your system in such a way that has been proven worldwide to be effective. So the way is for leaders to take leadership to drive universal health coverage. That way we can then approach all the other issues around service provision.
Oh, thank you very much, Prof. Dr. Berlin, the strike?
Well, let me just add a bit to, yes, Prof said Nigerians. He didn't say the government. So Nigerians means the community, civil society organizations, faith-based organizations, at your local government, state level, national level. That's what it means. When we're talking about the universal health coverage he's talking about, you see, we start from the community base. You can even start from extended family base. Do something like that, so that it's all about how to finance healthcare, so that we'll be able to provide quality services to everyone who wants and anywhere they want. Not that we should choose for them where to get it. Also pertaining, what do you say, strike?
That's fine.
No.
Thank you. Dr. Jot.
Yes, we are not there yet, but surely we will get there. And we need to address the 3 tiers of healthcare services. The primary healthcare, which has suffered the most, needs to be revamped, and there's need to retain our trained medical personnel, the doctors, the nurses who are flying out of the country in droves. The government needs to bring incentives to put these trained hands to serve the people it has trained to serve. I think that way we are going to achieve a lot. and other state governments can take clue from some government, like Governor Plateau State, that started the state health insurance policy, and that has gone a long way in easing the burden. Just this morning I saw a patient who would have spent huge sum on her monthly medications, but because she has been enrolled under the state health insurance scheme, what she paid was just a paltry sum, and that's just the way to go. So other states can take that and will help with the universal health coverage and ease the burden of healthcare from out of pocket. Thank you so much.
Well, great testimony there, great review there. And with this, we'll be drawing the curtain on this episode of My Health and I. Stay tuned to Equa TV next week, Thursday, for yet another promising edition of My Health and I. And hopefully then our regular hosts, Engineer Tony Nakale, would be back. But it's from all of us today in the studio, wishing you a happy independence, and we hope you've been enlightened about the National Health Act and the state of healthcare. Most importantly, we pray the government listens and ensure a greater inclusion of more Nigerians into health financing options, so that we can hear more lovely stories as stated by Dr. Jogara Jwat. Have a blessed independence. Thank you.